I would like to introduce my friend Jason Miller, who is a doctor of acupuncture and oriental medicine and works with Donnie Yance with the Mederi Foundation. Mederi Foundation Center for Natural Healing in Ashland, Oregon. Jade what? Jade Mountain. Jade Mountain Clinic in Ashland, Oregon. Yeah. Right? Yeah. Good. Okay, you're up.
All right.
And Jason is going to speak on acupuncture and medical oncology. Okay?
Thanks, Robert. Okay, that was quite a long list of credentials and history, rich depiction of my past. So it was kind of it was a development that wasn't too long ago, actually. I think that Robert called me up and said, hey, I really wanted to include a part of this oncological community, some ideas about acupuncture and oncology. Would you be willing to kind of present acupuncture and make some availability of research and make it CME ready for people? And I said, sure, I'd love to. So here I am. And actually, my background is, when I was younger, I really got into sciences. So I studied biology, and I went to the University of Minnesota there, and I was really very interested in being a doctor, actually. Studied biological sciences, was a pre-med major. And then about 3 years into my studies, I traveled around the country, traveled into Central America, and I kind of got an eye-opener, and I just decided that, there's something with the scientific model that didn't sit with me. I had looked deeply at the Cartesian coordinate system, and I looked deeply at the Newtonian physics and the Niels Bohr atomic atom theory, and I kept finding that these models didn't quite give me the idea that this was truth. And I had grown up with science, and I always looked to science as something that I could really bank on, and just and I really got interested in cancer at a young age, and I realized at that point in my life, I was about 21, 22, that if I was going to be working with people with cancer, or if I was going to be working on the epidemic of cancer, I'd have to do something to change the way that we live on the planet, because I just saw us as the metaphor of cancer, both inside and out, and that it was a very clear metaphor for me. And then as I went further along in my life, I became a musician, did other things, and eventually studied acupuncture and Chinese medicine in Portland, and went to China and studied there in the Nanjing Hospital and the Nanjing Institute of Traditional Chinese Medicine, and came back, and I had known Donnie for many years previously, and so I started working with him about 6 years ago, and got really deep into cancer, and kind of the same line of thinking as Gene and other people here, and looking deeply at the terrain, and as Dwight said, looking at the combustion engine on a very deep level. And so I've kind of gotten sucked back into it, even though I had originally intended to kind of create this lifestyle change, a permaculture, if you would, of my life, and it didn't work out that way. So here I am, working in the field of oncology, but I do a lot more than just acupuncture. It's one piece of what I do, and it's an important piece, actually. And so what I wanted to provide for you all today was a little bit of a look at what do we have in the realm of research around acupuncture, and why don't we have more research around acupuncture? And so those are the big questions I want to talk about. This first slide, just looking at what do we mean by acupuncture, because the licensed acupuncturist as a title is kind of a misnomer, because you have a scope of practice that includes the use of botanical medicine, nutritional medicine, diagnosis and treatment of diseases, working with the musculoskeletal system of the body, doing physical manual therapy, the use of needles, the use of electroacupuncture, moxibustion, and acupressure. And there's a whole host of therapies and diagnostic tools that are part of an acupuncturist's toolbox. But for the context of this course, I just wanted to focus on these four aspects. Just acupuncture itself, just the application of needles using the meridian system, electroacupuncture, using that system and applying electrodes to those points and connecting different points on the meridian system, moxibustion, which is really the application of heat, specifically using something called which is a mugwort that's been compressed, that you either hold over acupuncture points or you roll into small cones and burn on acupuncture points to bring heat into the system at specific points to treat someone, or acupressure or bodywork therapy, where you're actually using the meridians and using the human touch to actually either turn on or turn off meridian systems, rebalance and harmonize that system. So that's basically the kind of context I want to stay in for this course. And the first part of it for me that's really important is just a little bit about myself and my kind of, I look to nature and what I call the pre-Taoist poets as kind of a beacon for me of something, of an ideal I like to try and hold. And you can see this person here is a monk standing at a crossroads on a river on the bamboo. And there's nothing on this slide but just this image, which to me is important. And as a practitioner, I think it's very important that we hold a certain space for our patients and for ourselves, and that we're all working here as guides, and we need to have clarity in our minds in some place where we feel rooted. And so for me, I get rooted in nature, and I really do. I actually spend a lot of time in the forests around Ashland in Oregon, and trying to kind of take some of the energy that comes to me with seeing cancer patients every day, all day. I get to the point where I just really need to do something to let that energy just go. And so I go to the waterfalls in the summertime, and I go to the mountains in the snow in the wintertime. That's kind of how I clear myself. And I think that's a really important thing for all of us to remember, is that there's a lot of energy around this cancer issue, and it's really important to do some things for ourselves. And I think this, Robert's actually brought in some Qigong healers this weekend, and there's some yoga and other movement therapies that are going to be really helpful for all of us as practitioners to remember to integrate those every day, especially in the context of seeing a lot of cancer patients. One thing about these people, before there was Taoism, there were these people that were living in harmony with the natural cycles, and they weren't called Taoists, but they lived, trying to stay in tune with nature, trying to follow the cycles. They were very in touch with the stars, the constellations, and how did the movement of the stars reflect the condition of a certain place or time. And then a person fell into that, and so then they could observe each other within this greater, this macro to micro perspective. And eventually they were called Taoists who followed this thing called the Tao, which was that natural cycle. The same thing kind of happened with traditional Chinese medicine, where it was a practice in Chinese history that there were doctors who treated patients with these botanical therapies, and they used physical medicine as well. And it wasn't until later in the 1900s that when Mao was in power, he wanted to kind of consolidate some of their financial resources around medicine, and so he kind of pulled doctors from all over the country to get them together to create a system. And he called that system traditional Chinese medicine, which is not what these people were doing, but it's some kind of, he tried to generate a group of barefoot doctors that could treat a lot of conditions and help people without making a real expense and having to send them to, more invasive, more elaborate therapies, especially biomedical therapies, which were very expensive. I wanted to talk a little bit about traditional usage in this context, and for me, we're talking a lot today about evidence-based medicine, and so I wanted to provide for you, here's a path through the forest, and it's pretty clearly delineated. To me, that's what traditional usage really represents for me. Acupuncture's been around for arguably 4,000 years, maybe more. We've got a lot of historical writings and tablets and things depicting acupuncture from 2,000 years ago for sure, and so over that whole time, you have literally, millions of doctors treating billions of patients over thousands of years. To me, that's a pretty darn good source of evidence, okay? Barring clinical trials and things, that to me stands out. And the same is true of botanical medicine too. And so one of the issues I want to get into today is how do we bring our understanding of traditional usage and our understanding of a traditional system like TCM, which is this self-reflective system that's self-contained. Everything inside of it is looking at itself in relativity to each other. So you can't just pull things out of context. When you're applying acupuncture, you're doing it within the context of the TCM perspective. That's the traditional usage. And now how do we get from that into modern research? And that's where I want to kind of go through what the problems are today and how come we can't just say, yeah, acupuncture works, it's great, this is how you do it, it's safe, let's treat people. Well, doctors today want to say, well, where are the rigorous clinical trials? How does it stand up to drugs? How does it stand up to other therapies? And so we're working on that, and a lot of folks and a lot of energy is going into that specific question. But to me, I just wanted to clarify that to me, traditional usage is evidence, and it possibly is the best available evidence we have right now in this field of acupuncture, is the traditional usage. So, scientific validation. I've got a little quote from a research paper I was looking at. The ancient Chinese were primarily concerned with the efficient manner that acupuncture works and less interested in acquiring a logical understanding of its mechanism. So the Chinese are very organized, and they have a very elaborate empiricism where they observe changes over long periods and then record them. There's more writing in the field of traditional Chinese medicine than any other medical system in existence today. You've got all that history and all those people. And there's some big classic texts that became really famous about two millennia ago. One is called the Huang Di Ne Jing, the Yellow Emperor's Classic of Internal Medicine, and the other one is the Shen Nong Ben Cao Jing, which is the Divine Husbandman's Classic of Botanical Medicine. And those books kind of set the stage for a lot more writing and communicating between doctors around this large country, and how they would compare their therapies and their understanding of how they observed the body within this elemental context. So validating in terms of science, and one of the things that I'm really leery about these days is scientism, which one of my dear friends and colleagues, Jonathan Treasure, has done some good elaborations on. Using words like clinical trial and wearing a white coat and having a stethoscope and taking a picture, that suddenly means that you must know what you're talking about. And I don't know that that's true, and it's not always true. And so it's an important thing for me just to remember that scientific validation, to me, has to include evidence-based medicine. And what is evidence? And so there's many layers of evidence for us, and there's empiricism and there's observation, which I do think is very important. So I've got here, why isn't acupuncture, just right at the forefront of modern research? And we have some difficulties with acupuncture research. The difficulties are actually several-fold. One of the first ones is that if you take, like I said, a complete system, a holistic system, a self-reflective system that has its own terms that relate to each other, and you take and you apply those to a person, it's really hard to take that person and then standardize them to one type of care, one type of treatment. So there's a standardization problem. But even before that, how do you double-blind an acupuncture study? It's a really hard question to overcome. And we've done, there's been a couple different ways that people have gone about this. And you can definitely create a control in a randomized clinical trial with acupuncture if you blind the patient, literally. You have the patient laying down on a table, and you put a little frame over in front of them, and you hang a piece of fabric there so they can't see what's happening. Now the practitioner then, either they're giving the person real acupuncture, true acupuncture as it's called in the research, where they're actually using a tube and inserting a needle into a certain depth at a certain point on the body that's related to a certain condition that we're studying, or the control group gets a tube with some sharp object, like a toothpick or a small sharp piece of metal that's tapped onto the point, but doesn't actually go inside the skin. So that's one type of true needling versus sham acupuncture. And then there's another type, and that one is actually where you take the acupuncture needle, and the same situation is true. There's two different groups. You don't have to blind the person by putting a fabric in front of them, but the one group actually gets acupuncture needles to a certain depth at true acupuncture points, and the other group gets acupuncture at what are called non-acupuncture points. Interesting that both of these methods of controlling for acupuncture in the randomization process create an interesting dynamic in the placebo effect, in the placebo realm, because essentially you're comparing two treatments in either case. You're not actually having a control. You can't, one person can't be blinded, if they either know they're getting something or they're not. So even if you give this person acupuncture that's not acupuncture, you're still stimulated the specific point. And if you did it at a point that wasn't a true acupuncture point, you still needled a point. And when you go and look around at the consensus on what are acupuncture points, what are the meridians, what are the deep meridians, it gets to be this huge conglomeration of information. And going back, way back, pretty much every point in the body has some relationship to what's going on inside the body. It can treat different conditions. So one of the big problems is how do you get rid of that confounding factor? And that hasn't been solved yet. So a lot of the research comes out, and the big criticism is, sure, that acupuncture worked for this group of people, but the control group, it worked almost as well for. And they say, so it didn't really work because it didn't outperform the control. Even though both the control and the treatment group both outperformed the placebo or the drug therapy to some really incredible degree. So that's been a big problem. I wanted to talk a little bit too about the meridian system, and just that you understand that the meridian system is a very complex energetic anatomy. And for me and the people that I work with, and I do a lot of teaching, I like to really help people understand that there are layers of the anatomy, and you have the structural anatomy, the physical anatomy, then you have the energetic anatomy, and if you can see all of those and utilize them all and be able to integrate those layers as you look at a patient, you're going to really deepen your ability to understand what's happening for them. And the meridians generally are thought of as coursing on the surface of the body and relating to deeper areas. So for instance, if you're not familiar with acupuncture, the organ systems, there's 12 primary organ networks that have been defined by functional relationships. They're not the same, they're not actually physical organs. Yet we talk about the kidney, we talk about the spleen, we talk about the lungs and the heart, we talk about the liver and the gallbladder, and each one of those organs has a meridian that's associated that travels on a certain part of the body. So if you find a problem at a point on the body that is along a meridian, you can start to think, I wonder if that's connected to the organ that relates directly to that network of meridian points. So then you start to see things like, person's getting ringing in their ear. Okay, well we know that the kidney has a deep branch that opens into the ear. Oh, interesting. That's probably what they're probably having a kidney issue, and we would go to something that's called kidney yin deficiency in our system. Most of those ear ringing symptoms, if it's a high pitch. But just an example of how the meridian system and that energetic anatomy is a system that you have to work very hard, you have to deeply understand to apply acupuncture. So that brings me to another part of the problem with acupuncture research. So most of the clinical trials that are done are based on applying a specific acupuncture point or a few points to a condition. So we're going to talk about pain, we're going to talk about nausea and vomiting. So let's say the control group and the treatment group are both going to come in with symptoms of post-operative nausea and vomiting. They both have a similar demographic. They've gotten rid of all the factors that would confound the study. You've got the control and you've got the treatment groups. And then instead of the practitioner coming up and saying, okay, I'm going to assess this person. I'm going to take their pulse. I'm going to look at their tongue. I'm going to examine their skin. I'm going to thoroughly question them. And I'm going to create a treatment for them that might include the 2 points that we've chosen for this research study because they have an empirical relationship to that condition. But I would also give you a bunch of other points that would treat the underlying condition that I have diagnosed you with, which would be your pattern differentiation. How do we differentiate each specific patient? And this is obviously the big problem and the stuff that Gene is talking about and Dwight. How do we research tailoring treatments and tailored treatments for people? It's very challenging. The same exists for our acupuncture studies. So most of the studies you'll find are done on, we treated this one point and we measured the results against one condition. That's not how acupuncture is practiced. But we're still showing really good results, which is really, really intriguing to me. But it begs the question to me, is the randomized, double-blinded clinical trial, is that our gold standard for evidence-based medicine, especially in the context of tailored therapies that have an incredibly rich traditional usage? I'm just throwing the question out there. Cancer prevention. So the first thing I want to talk about in oncology, and I think that everybody's done a great job today of addressing the idea of stress, and stress as being a huge factor, not only in getting cancer or getting a diagnosis of a named disease. And I always see people as their stress system gets upregulated, they've been under an allostatic load for a long time, the body's shifting into this a different kind of shape, literally, where it's sort of heightened and it's kind of working to overcome the stresses of life. And those stresses might be, whatever, it could be emotional stress, relationship, could be the stuff at work, but it's definitely also the environmental toxins, and it's definitely the sad diet that we're talking about, and it's definitely the pollutants in our air, and it's definitely many other factors that we all are coping with all the time. That stress builds up for the person, and the stress itself creates a change in the neuroendocrine system that actually can create an environment that is more permissive and less non-permissive to the mutation that we know as cancer. So how would acupuncture apply to this? And it would apply to it wonderfully, actually, because one of the greatest things you see when you're working in a clinic with patients and giving them acupuncture is that they come in and oftentimes they're really stressed out and they're just, life is hard, and you talk to them for a period of time, you get them kind of calmed down, and then after a while you've assessed their situation, maybe you're writing up a botanical protocol for them, a nutritional protocol. thinking about their diet and what, their condition, then you're going to get them comfortable. Lay them down, give them some acupuncture. Maybe you work on their body a little bit first, and then they relax. And you put them into a nice state of calm relaxation. People come up out of there and they're like, oh my God, I feel so good. I feel so transformed. I can't validate that that's going to prevent cancer, but I sure can tell you I'm treating myself that way. My wife's an acupuncturist. I have her treat me because I don't want to be stressed, and I know that stress leads to cancer. I know I feel better when I get acupuncture. So again, I don't have any research there, but this idea of cancer prevention and stress prevention, acupuncture plays a huge role in. And I think also, I just want to say something about art and science, and that the science part of my brain, was really developed as a young age. When I was 4 years old, my mom always says, God, you were so crazy. You were 4 years old, you're running around with a notebook saying, Mom, make me more math problems. And I would ask her, and she'd make me math problems, and I'd just do them. And I just got so into math and science. And then as I grew, there was a break in my studies, and I actually became a musician. And that's what I really got passionate about music. And so I'm also a drummer, and that's a big part of what I do. And so as a drummer, what I have to do is I have to listen. I've got to listen to the other musicians because I'm working with a group and we want to create something together. If I don't listen, then I'm just playing music over these guys and there's no communication. The music doesn't have that incredible feel, that X factor that we're looking for, that feels good. And I think it's exactly the same in the medical practice. The artistry is there to be with the person, to listen to them, and to truly hear what they're saying and hear what their body is telling you as you look at their eyes and their fingernails, look at their tongue, and hear the sound of their voice. So all of that is really important to me. And calmness and relaxation, I think, coupled with keeping the bowels flowing, keeping the normal bowel movements, and keeping people sleeping well. If we can just do that, I think we're doing a huge service in the realm of cancer prevention. And I really do think that this one of the places that acupuncture could really shine as a therapy, as an adjunctive therapy in cancer. And in this case, it would be a primary therapy. And Chinese medicine was primary care for an incredible huge amount of people for a very long time. It has a lot of efficacy, in the traditional context, and we would say anecdotal cases, but doctors who have treated thousands of patients, they know what they're doing, and you go to them and you'll see that your knee pain gets better, your back pain gets better, if they're good at what they do, if they're a good artist as well as a good scientist. One of the areas I wanted to also think about was talking about the epigenetic domain and talking about how can we influence the epigenetic domain and how can we have an effect on tumor suppressor genes, P53 and P10 and P21 and P27 and all these wonderful stop mechanisms that we have that oversee the transcription of cells in our body, making sure that the mutations are shut down before they're allowed to proliferate. Well, I think that acupuncture actually, if we could research it, would influence that as much as avocados do, as much as broccoli sprouts or other things, But again, it's a difficult thing to research. It's really hard to study. So I'm asking you guys to go out a little bit beyond the clinical studies before I get into them, because that's what's coming next. And before I do move into mechanisms of action on the scientific level, there's something in Chinese medicine called the qi of the doctor and the qi of the patient, right? And qi is what we talk about. The system of meridians is basically a system through which flows an energy called qi. And it's like this kinetic force, it's a functional force, it helps, you could think of it as some part of the mitochondrial function, cellular energy. It has a lot of different possibilities in the Western mind, but in the traditional Chinese medical mind, it's really a force that flows along the nerves, along the blood vessels, that creates muscle tension or vascular contraction or dilation. It controls the functional aspect of the physical system. So the qi of the doctor and the qi of the patient is a really important part of the relationship in the acupuncturist's career. And if you can create a relationship with the patient where the qi is matched and there's a space that's created between you and that patient where it's comfortable. And that first word that comes up in cancer care, which I think that it was, I'm not sure if it was it Moshe who brought up that the first word was fear. That's the first word people think of when you say cancer. Well, how can we help people to not feel that fear? And part of that is just your presence, just being there with that person, sharing the qi of the patient and the doctor to a place where they feel comfortable and they feel comforted in that space. And it's just something that I think keeps coming up in everybody's talk, and something that Donnie's talked to me a lot about as well, is just how can we create the space for the person where we're not acting out of fear, first and foremost. So I'm going to go right ahead and move into the scientific side of things, which for me is mechanisms of action. This study was really interesting to me. It just came out not too long ago, and it was actually a review I read from this presentation in Barcelona, 2010. And it was a study done on mice, and they took quite a few mice and they injected them, they actually just gave them a dry needle in the paw at an acupuncture point specified. And they showed that the tissues that were needled had 24 times the concentration of adenosine than before treatment. So it's part of the body's reaction to this, possibly a puncture, something like that the tissue is flooded with adenosine. And I can see Dwight's head's turning over there. He's probably got something wonderful to say about it. But I think this is very interesting because adenosine is it's an inhibitory neurotransmitter. And it actually is part of the reason that caffeine stimulates us, because caffeine, its purine part of the molecule, fits right into the same place that adenosine would. And so it can inhibit some of adenosine's function. So you get some adenosine blockage, and you actually get some of that lack of neurotransmitter inhibition going on with the adenosine, with the caffeine part of things. So this could be a really nice aspect of how you can show that acupuncture is actually having a direct effect, not just on the energetic aspect of the person, but on the physical part of the person's, the endocrine system, what's actually being secreted by the cells, the fat cells, the glands of the body. I put a couple other studies here. This Capodai study is a nice one, looking at neurotransmitters, connective tissue effects, and a lot of research if you dig around on connective tissue effects in acupuncture. And there's been some researchers trying to dig deeply, especially in Germany, into how does the connective tissue system relate to the acupuncture meridian system. There's been some beautiful corollaries actually drawn, but it's a long stretch to get to the point where you can really apply the meridian system to the connective tissue system. And a lot of it was done around planes, connective tissue planes, and how those lined up with 82% of the meridians on the body when they studied just the meridians in the arm. These studies here with a decrease in inflammatory cytokines, increasing T lymphocytes. There's the adenosine study, neuropeptides. These are review studies. That's Steven Segar. Opioid peptides, so a lot of pain inhibitions, peptide hormones, stem cells. This is just from acupuncture itself. A considerable body of evidence suggests that acupuncture modulates neurological processes to bring about its effects. One of the things that acupuncture says about itself is that it's a system that promotes self-healing. And the one thing that's wonderful about becoming an acupuncturist is that you don't have to worry too much about giving someone the wrong treatment. You might not be effective. You might not help them nearly as much as you could have, but you're probably not going to hurt them. It's a very self-regulatory system. You can help somebody. It's kind of like Donnie, when he was training me about herbs 6 years ago, said to me, if you're giving someone an herb, you're probably helping them, even if it's not the perfect herb. The fact that you're giving them something and they're taking it from you and they're taking it and they know that you want them to feel well and they want to feel well, if you have a pretty good idea, you're going to help that person. And I think it's the same thing with acupuncture, And for me, it's never a thing of, rarely, that is, I don't needle the head if people have migraines. I don't needle the scalp because I've had people actually their headaches get worse. But there are very few cases actually where I find that you actually aggravate a condition with acupuncture. So it's pretty safe in that way. One of the other things that acupuncture does, more from a traditional Chinese medical mechanism, is that it promotes the circulation of qi in blood. So you're putting a piece of metal, a conductive material, into these points, which literally now have been studied. And when you go across these things with an electromyograph, you'll find out that the highest conductance and the lowest resistance in an area of tissue is almost always at the acupuncture point in that area. That's pretty interesting to me. So then you take a piece of conductive material, a piece of metal, and you insert it into that point. And you've just created conductance. You've created a flow of energy through that point along that meridian in that connective tissue. You've influenced the fibroblasts. You've influenced the chondrocytes. You've influenced the cellular function and all the tissue of that area. And there's an electromagnetic exchange happening there based on the application of that needle. So cancer, as Dwight pointed out to me, is a coagulopathy. This was a long time ago. He said, cancer is a coagulopathy. And I was like, oh my God, hypercoagulation, coagulopathy, blood stagnation. Chinese medicine, acupuncturists view cancer, tumors, as blood stagnation. So how can we help stagnant blood? Well, we promote the circulation of blood. We remove blood stagnation. Acupuncture does that wonderfully. It's amazing, actually. And I don't actually take a lot of my patients and just give them acupuncture and then watch their blood levels. I actually normally give them acupuncture plus turmeric and green tea and resveratrol and everything else that we've been talking about today. And a Chinese medical formula and boswellia, and they're taking broccoli sprout extract, everything. So I can't tell you directly that I've seen the acupuncture drop C-reactive protein levels. Haven't seen it drop the SED rate. I haven't seen it directly influence fibrinogen or D-dimer or PAA1 levels. But I can tell you that as a part of the whole process, it's working because my patients are getting well and symptoms are being managed. I see a lot of stage 4 cancer patients that are pretty far along in my clinical practice that just really need some support because their herbs are hard to take. I've got a stage 4 mucinous grade carcinoma all over my body. Man, 5-FU is not working for me, and I've got this pump, and I feel terrible, and they give me these medications, and I can't even take them, and I can't take your darn herbs. I can't take all those capsules. Well, I give him acupuncture, and his pain's gone for 24 hours. Amazing. That's like, to me, is so valuable. And so, even though I can't show directly that I can say, acupuncture lowers CRP levels, I really think it probably would if we studied it in the right context. Probably not as a double-blinded study. One of the things that's influencing acupuncture's validity today is that lower quality studies within the scientific model have kind of hampered some of acupuncture's acceptability. And the main criticism is that the interpersonal skills of the practitioner tend to be more powerful than the needle or its equivalent. Well, that's okay with me. I'm okay with that. So let's go to how do I apply acupuncture in the context of cancer, and what do we have as far as research in that area? So pharmacotherapy side effects. Pharmacotherapy. We've got some fire flaring up here. The big ones, GI effects, nausea, vomiting. Those are the big ones that I see all the time. Vasomotor neuroendocrine, you've got hot flashes, night sweats, hormonal therapy, pain and neuropathy, platinums, taxanes, and just pain from cancer. The Shen, I said, is the spirit, and sleep disturbances. So people who can't sleep at night, we really have to get them sleeping because that's going to be a big part of their recovery, their ability to take any more therapy. If they can't sleep, they can't regenerate. They can't get into that parasympathetic state. So one of the big places, the antiemetic studies are the most prevalent and contain the most promising results. So this is really, a 2005 review of research that they said this right here, just got more excellent results. This Cohen study, Cohen's done a couple other studies. And this is an area on nausea and emesis where acupuncture has been studied extensively outside of the context of cancer, but more recently in the context of cancer, and especially in looking at non-pharmacological approaches to how we can manage these symptoms that are really dose limiting to people, for all kinds of therapies. More on nausea and emesis. These are just, all those studies right there are all just studies that are controlled studies, obviously not double-blinded. Some of them are double-blinded based on, that are sham versus control acupuncture. But you see, all those studies show positive results, all of those. They're all acupuncture at one point, pericardium 6, called Neiguan, the inner courtyard. It's right between flexor carpi radialis and palmaris longus on your wrist, 2 inches up on the wrist, right here. If I teach you one thing today, if you remember that one point, that point is phenomenal for morning sickness, for nausea, vomiting, for any problem with what we call a rising chi. Just that one point, if you take your finger from your wrist, you put it between those 2 tendons that you can see there, and you just slide down to where your finger stops, press in that point, and you can give that to, just tell your patients. One of the studies here actually showed that, the acupuncture point stimulation, here it says better than ondansetron, right? So Zofran, better than one of our big medications in its analgesic effect. Again, I don't think the control was too far from the actual study group. But when they put that wrist, they put something on the wrist that actually pushed on that point, like a little wristband with a little piece of metal that pushed there, people got 24 hours of relief after one treatment. So this is something you can take home. You can actually have your patients push on that point. Nausea and emesis, more pharmacological approach, not the only possible strategy, and that's really important because a lot of the people I see, they just get to the point where they can't take anything anymore. They can't take any more, whether it's put into their veins or if it's through their feeding tube. It's just some people just can't take anything, so this can really help. And when you get them feeling well, when you get their nausea calmed down, you get them to stop having the problem with their digestive system, then they can take all the wonderful herbs that they need to take to help potentiate their chemotherapy or help to offset other really debilitating side effects. Electroacupuncture, another study just supporting of electroacupuncture, the same thing, just using here electrostimulation at the same point and showing that it was as good as other therapies in nausea and emesis. And then I brought all this study in as well on pediatric oncology. And this is a really interesting one because they had 23 kids here that were receiving a real nausea-inducing chemotherapy of different types. They were randomly allocated to receive acupuncture. And it was during their second or third course of chemo, and they were looking at basically the amount of additional antiemetic medication they needed during chemotherapy. And they showed that in this study that all these children improved. It was the pain score in the children was very low, like 3 out of 10, or 3 out of the total group of 23 children had any kind of problem with the acupuncture itself that said it was painful, and then they were all able to reduce their amount of antiemetic medications, especially breakthrough, needing more medications for nausea. So I really like that too, and it's another level of artistry when you're working with young children and you're going to put needles in them. It's really an interesting place to be, and it's fun though when they can finally get to the point where they're like, okay, I think I'm going to do this, and then they really like it. I had a bunch of group of kids, oh, give me acupuncture, I want acupuncture. So neuropathy, and actually I was just talking with another person here today who was telling me their story about lymphedema and how the only thing that would help her get range of motion back was getting acupuncture. Every day she got acupuncture in her arm. It wasn't lymphedema. It was a breast cancer that the surgery had caused nerve damage that led to neuropathy, and she lost her range of motion. But she'd get acupuncture and she could walk out of the treatment and she could move her arm. That's just one little anecdotal case study of someone who's here, had that experience, but there's a lot of studies on neuropathy. Most of them are actually in other conditions, and a lot of them in diabetic neuropathy, and showing just really great results. And in my own clinical practice, I've seen a lot of platinum-induced neuropathies that I've been able to really help people with. It takes a long time, and I still give them N-acetylcysteine, and I still give them isothiocyanates, and I still give them, all the glutathione precursors. But then you can see the immediate results when you give them acupuncture. It's like, oh, I walk out of there and I'm not tingling. For a few hours, I don't have that pain. I don't have that sensation. So a great adjunctive part of that. Pain is just a huge subject in acupuncture, and I mean it's just immense when you look at the amount of research that's done on acupuncture in the treatment of pain, and it is one of the things that actually acupuncture is covered for now by insurance companies. So those of us who are acupuncturists know that you can pretty much treat anyone as long as you're billing them for a pain condition. If you try to bill them for something like emotional distress, you're not going to get paid. It's pretty much insurance companies are going to pay for pain or neurological issues, and that's because there's a lot of research supporting the efficacy of acupuncture in those realms. I wanted to talk a little bit about bone marrow suppression, and specifically, both Dwight and Donnie have brought me aware of this, actually, about bone marrow suppression, and moxibustion is actually the treatment of choice when people have a lot of marrow suppression. That's, again, like I said, the application of heat to specific acupuncture points. And you can promote, in this one study, this is an animal study, 224 rats, but they actually gave the rats moxibustion, where they applied heat to 3 different acupuncture points every day for 2 days and then 7 days, and then they measured these. They actually looked at DNA excision repair proteins. And I've just been learning more about excision repair proteins, like in the context of platinum drugs. And so really nice that you can see that moxibustion, it's non-invasive, it's something people can take home with them. You can send them home with the heat, their own little application for moxibustion, teach them the points, they can take it home and show that actually get an increase in white blood cells, an increase in natural killer cells, macrophages, really quite nice. And this animal study did a nice job of kind of looking at some of the specifics around hematopoietic cells and in the context of being damaged by chemical drugs. Again, it was an animal model with a chemically induced bone marrow suppression, and really nice results in that study. Another one here, in comparison to medication, excels in simplicity, prompt curative economy, and freedom from side effects. This is actually just a Journal of Chinese Medicine entry, 114 case controls treated. These guys were very serious about their evaluation. Effectiveness meant that the white blood cell count was up above 4,000. So they showed here that 51% of them showed marked effectiveness, meaning their level within the first week went up over 4,000 of white blood cells. And these are people on chemotherapy. So a really nice example, again, of how the modality of acupuncture can really be helpful for us in supporting myelosuppression, which is really a big issue, and that's the main reason why our patients are not getting their chemotherapies, is because they're having bone marrow suppression, their white blood cell counts. Most oncologists I run into, your white blood cell counts below 2.5, you're either going to get a Neupogen or Neulasta shot, or you're going to have to get, you're going to take a week off from your chemotherapy. That's a scary thing. So how can we help people? I've got a really nice case of a woman with triple negative breast cancer down in LA who's actually just finished the PARP inhibitor trial going on there with olaparib. She's doing quite well. It was really debilitating, but along her course, there was 1 week where her white blood cell count was at 2.1. Her oncologist said, I'm going to have to give you some Neupogen, and she was like, well, I really don't want to do that. And he said, okay, well, I'll give you a week to get your levels up, because she wanted to work with me. So I said, okay. So I sent her a formula. It's called Dongwei Bushui Tong. It's just astragalus and Dongquai Angelica. It's a 5-to-1 ratio, but you do big doses of that. That's real red blood cell supportive, real erythropoietin stimulating. Gave her the moxibustion. She did that every day. And then she did our Immucare 1 formula, another formula that had a bunch of mushroom extracts in it, and her white blood cell counts were 5.4. On 1 week later, 7 days later. But she was very diligent about doing her moxibustion every day. And I just think it was just one of many cases where I saw how directly the combination of therapies created something really special. Another area, sleep disturbance. Insomnia, obviously one of the big ones for us. You can do a lot with acupuncture, and electroacupuncture especially. And we talked about adenosine, we talked about neurotransmitters, and being able to calm the patient down, relax them. Big part here. Again, here's a study where you had 15 of 25 patients, more evident efficacy in cancer patients, even 11 of the 14 cancer patients. And that's just needling 1 point. That's just heart 7. That's just a point right here on the wrist. Shen Men means the spirit gate. It's a great point, but there's a bunch of points that you do for people's insomnia, and you want to get it tailored. So if we could see how well these people are doing if they really get a great acupuncture treatment. Hormonal therapies. I thought this was a good picture. A lot of my female patients can relate to this part of their hormonal therapy, especially tamoxifen. Some of the women I have on tamoxifen, it's just brutal. The hot flashes, night sweats, it's just amazing. And you work so hard at it. I had one woman recently in Minnesota who recently the best results she's gotten so far from anything I've done for her is I sent her to an acupuncturist. Really helped. It's great. I had her on a massive therapy. I tried everything. Anyway, nice study here. This Eleanor Walker study, this just came out not too long ago. This is a study that was comparing venlafaxine, Effexor, interesting subject, to acupuncture in tamoxifen-treated women with vasomotor endocrine side effects. And they basically showed that, both the treatment and the control groups did really well. They did as well as the people taking Effexor, okay? But that's been the big critique of the study. It's like, oh, you guys, this study, acupuncture didn't really work. The control got 47%, and the acupuncture group got 42% improvement, Effexor got 43 or whatever. So acupuncture didn't really work. It was a placebo. Okay, that's fine. But why are you giving these women tamoxifen Effexor again? Isn't that a CY2D6 inhibitor? Anyway, yeah. Well, Donnie will probably get into that tomorrow. Did that go over your heads, guys? No? You're with me? Okay, good. I just thought it was funny to have that study critiqued, about whether acupuncture works or not. Why are you giving a woman Effexor? Anyway, okay. So radiation-induced side effects, pertinent topic. So the big ones that I see are, dryness, vascular insufficiency, friability of tissues, hemorrhaging and fibrosis, and a lot of blood stagnation. And for those of us in this field, folks who are being radiated, the damage comes up later down the road. You start seeing, people's, a year down the road, they're having terrible side effects from radiation. So giving people acupuncture along the way is a great way to help strengthen the integrity. Like I said, it works really well with the connective tissue. We're just getting into the deep sort of understanding of how that all comes together, but we can really support people who have had radiation-induced side effects with acupuncture. A lot of great studies done specifically on xerostomia, just a decrease of saliva, and I just pulled up 3 good studies there that are recent that did a nice job of double blinding in our sense, that in our model that we're using. But increasing whole salivary flow rates, either you give them the stimulation, you give them a piece of candy basically to start things going, and then you give them acupuncture and they do really well, or without the stimulation. but really good improvement for up to 6 months. And additional acupuncture therapy can maintain this improvement for 3 years in one study. They did a nice long follow-up. So I thought it would be important to talk a little bit about safety. Again, we're back to that 4,000-year history. This is safe. We know how to do this. People have been doing this a long time, and the basic things that you're looking for, as possible side effects are local irritation of tissue, which actually for us is something we are looking for. You get something called Sha, which is the word for sand, which means this kind of a reddening of the tissue around the needle. That's actually a really good sign that the body has integrated the treatment and that there's a reaction happening there. I think Dwight could probably elaborate on the immunological happenings inside the tissue there more than I could. But that would be one of the things. And someone might have that reaction later in the day. Someone called me and said, God, I still have this red spot. I'm like, that's great. Awesome. And they're like, really? Wow, I thought I was having some kind of infection. No, I've never had a person get an infection from an acupuncture needle. I don't know anybody who has. I'm sure there are studies, when I was in China studying, they would walk around with a tray of needles, in the acupuncture wing of the hospital, and they would take them, and then somebody would take them and wash them in alcohol. On to the next, folks. We don't do that. They're all fresh needles every time. But bruising, if you get close, right into a capillary bed, which can happen, and everybody's got a little different, especially you find, sometimes elderly patients have a little bit of friability in the capillaries. People with vascular insufficiency, they're a little more prone to bruising, so you might get a little bit of the tissue can swell in that area. What I always do is if I take out a needle, if there's a little bit of blood or something, it's a 30-second hold pressure with a cotton ball, it's gone. Very rarely have that happen. It's really, one of those things that you needle, because some people with macular degeneration or things like that, you can needle right along in the eyes. The bladder points are here and the stomach points are here, and you actually drop a 1 or 1.5 inch needle along the eye right there. Pretty amazing therapy, but it's incredible. What you can do for people as far as improving their outcome. But if you do hit a capillary there, you got to make sure you got the pressure on there, because then you're giving them a bruise right here. I remember I had an acupuncturist friend once. I ran into him at the co-op, and one of his patients was there saying, "You bruised me, man. You bruised me." I was like, "Oh well, it happens." But you can prevent it. Fainting is one thing that can happen, and actually in one of my clinical rounds, I had a stroke patient who we gave acupuncture to sitting up. I was there with the doctor in the clinic, and the person got what's called a needle shock reaction. And every 1 in 1,000 patients or something just reacts to the needle, and you put the needle in them, and they're just like, "Whoa, I feel kind of," and they're just down. It's like seconds. It's amazing. So we had this one guy do that, and he went into the full, he just kind of fell back, and so we had to grab his tongue and, give him a nice pressure at governing vessel 26 here, which is another great point. If you ever have a situation in a medical emergency, that point right there with acupressure is called Runjong. It's like the man's center, human center. That point will pull a person back. I've pulled several people out of really intense situations, even in viral meningitis and things where people were really kind of checking out. You could just get a really deep pressure right there, right on the frenulum there. Just hold that point. The one thing that you can induce, and I have seen, is pneumothorax. We know about that. You can puncture a lung. So when you're needling around the chest anywhere, you make sure you're oblique in your insertion and you don't needle that. And that's why I say, just as much as I'm encouraging medical doctors to really understand the energetic anatomy, because it's a great adjunct to what you do and how deep you can see and how you can layer your lenses, but for the acupuncturist too, you got to know the physical anatomy. You should be able to tell me every point, every structure you're hitting below a needle if you're inserting a needle there. That's my take on it anyway. I'll have to quiz myself and see how I'm doing. So let's see. So acupuncture is definitely, a lot of studies showing that it's safe with minimal side effects. And most of the research I did show you, there's a section in there about safety, and it has a great safety record. And side effects, like I said, that's really it. There really aren't many. A little bit more on safety. Here we had 237 acupuncture sessions, severe, moderate, and mild thrombocytopenia. So these are folks who have platelet deficiency, who have bleeding problems. Well, they didn't have any problems with acupuncture. None of these people. So I just wanted to put that up there just to show you that it's really pretty safe, exceptionally safe. The needle is very, very small. It's filiform. It's not hypodermic. Very rarely do you have any bleeding. And like I said, if a person has really thin blood or vascular insufficiency, you can get a little bit of blood coming out. You just give them a 30-second pressure. So I just recommend that if you are referring to an acupuncturist, which is my next slide, just make sure that you're confident that they have a really good training. They know what they're doing. They really have a good understanding. And you should be able to gather that by talking to them. So when and why referrals? the main, I mean, I'll just break this down really quickly. The only reason I would say don't give someone a referral to acupuncture or for other modalities in the acupuncture scope of practice is if you've prioritized the person's financial availability and then the treatments that are the most important for them. If acupuncture isn't among the top that they can afford, well then it's not worth going that way. It's got to be either they have insurance coverage, which some people do, but if they don't, and they really need to be taking their certain medications or their certain herbs and things, those things could take priority. So you might not refer them to acupuncture at that time if it's more of a burden. But for most people, acupuncture is really a beneficial thing. And again, like I said before, the time between the practitioner and the patient, the doctor chi and the patient's chi together is a really wonderful adjunctive part of the therapy as well. I think of acupuncture myself as a part of what Donnie will be talking about tomorrow, the ETMS system, which is the eclectic triphasic medical system that I work with Donnie in and day out, and Dwight McKee and Jonathan Treasure and more of us. But I think of acupuncture as one of the tools in our ETMS toolbox. And acupuncture has a place at the top of the pyramid. If you look at the top and you have energy medicine at the top, at the bottom of it we have radiation and we have chemotherapy and we have surgery. And there's a lot of therapies in between, but acupuncture is normally thought of at the top, kind of up there with homeopathy, energy medicines that can affect great change. But a lot of times people need to address the situation that's happening on the physical level, and I've seen that where the cancer that has a hold of them, like Dwight was saying earlier, has a lot of momentum, it's aggressive, it's an animal, it wants to survive, and gentle energy therapies are great for the person. They might help that person come to an emotional place where they're really happy, they're okay with their death. But if they want to live, God, we're going to have to get in there and do something on the physical level, fight that animal, Jonathan says, if the Battle of Waterloo has come to your door, you better get your armies together and fight. But acupuncture has a great place as an adjunctive therapy in advanced cancer cases. That's my main message, and there's great research to support it. I loved this quote here from Cohen here, Dr. Cohen. At the end of the day, the doctor's out there looking for things to help their patients. There's only one kind of medicine. These concepts of alternative medicine are something of the past. That's it. Questions?
Hi, Jason. Diane Hogarth from Ontario, Canada. I just want to thank you for a brilliant presentation, and especially because my acupuncturist doesn't speak a word of English. And now I know so much more of what she's been doing, so I really, really appreciate it.
Well, you're a trusting soul then, right? Thank you. Thanks, everybody. And I just want to say one more thing, that it is just really quite an honor to be here and to be among all of you incredible minds. It's really quite special. I feel like this room is supercharged, and I'm really glad that we're all here together doing this work. Thank you.